Brilliant. Yeah, right. Good morning, good afternoon, good evening, everybody. Welcome to the fourth seminar of our monthly series in the Fleming Initiative Alumni Network. And today we've got the Partnership for Supply Chain Management, PFSCM, joining us today. So we've got Tim Meehan and Amanda McDonald as well. So there's a bit of a quick introduction before we get going. The PFSCM is a global health supply chain non-profit specialising in ensuring that needed health products are available to the people who need them in low and middle income countries. To do this, the PFSCM have partnered with leading suppliers to offer preferential access pricing to eligible clients, leverage their pool procurement capacity to negotiate low prices on other products too, and offer full service technical guidance from product selection to negotiation on service level agreements and delivery, all undertaken by experts in this space. They also recognise the unique challenges that the supply chain for products used for AMR related diagnostics pose. So we'll kind of start off with Tim, is a diagnostic scientist and senior lab technical advisor based in the US. I think he's currently in Europe at the moment, so it's not too early for him today. His experience spans from academia, commercial diagnostic development, and then the global NGO space. And then Tim represents the PFSCM and the Fleming Initiative as the co-chair of the Access Working Group. And then we've got Amanda, who's the Director of Business Development and Partnerships. She's now based in the Netherlands and has been with PFSCM for 2 years. Previously, she had worked with several global NGOs and support the Fleming Fund project while at the American Society for Microbiology. So that's the quick introduction. I'm then going to pass it back over to Amanda and Tim now, who can start the presentation. Thank you both.
Thanks, Michael. So microbiology lab supplies and other AMR-related diagnostics are a key focal point for PFSCM and is increasingly more important for us. This is through our work with the Ministries of Health directly, as well as with our work with the Global Fund, and also in part due to my personal passion for helping to fight AMR. Regarding this, I am, as Michael said, the co-chair for the Access Working Group within the Fleming Initiative, which is partially why we are here speaking to you all today. And our main objective here is to let you know everything about PFSCM that may be necessary to help support all the great work that's been done by the Fleming Fund over the years, and to help labs maintain the capacity that has been developed through the Fleming Fund in the now departure from that organization from the global scene. So Amanda, you want to take it over here, and then I can come in later on?
Sure. Thanks, Tim. Okay, so we're going to go through, I think it's just a relatively brief slide deck that kind of explains what PFSCM is, how we work with organizations, and then specifically how we've, over the last couple of years, as Tim mentioned, developed expertise and some strategies behind supporting our laboratory partners with their microbiology and AMR product needs, knowing that it is a kind of a unique supply chain, but a very important one. So I'm just gonna, hopefully this slide deck is gonna work. There we go. Okay. So as Tim mentioned, we are the Partnership for Supply Chain Management is a nonprofit organization. We are a US-based organization headquartered in Arlington, Virginia, and an affiliate of JSI, a larger global health and education nonprofit, which some of you might be familiar with. That being said, our operational facilities are largely in the Netherlands now, and we have staff kind of dotted throughout the globe. And our core mission is to serve donors, governments, humanitarian programs with procurement and fourth-party logistics solutions and services. We are a QMS certified ISO 9001:2015 organization. We do comply with all the sustainable procurement regulations and guidelines. And we really do have quite a diverse catalog. We specialize in medical devices and pharmaceuticals, and currently our onboarded catalog contains well over 6,000 respective products. We are currently serving over 70 countries, largely because we are the Global Fund procurement service agent for diagnostics, condoms, and lubricants. So, wherever the Global Fund works, we work, but we also have direct clients outside of the Global Fund, whether they're ministries of health, other NGOs, universities, or just other partners in the global health space, public health space. That being said, about 90% of our work is actually on the African continent, but we do, I think, deliver pretty globally at this point. And we are a very diverse staff. We have staff from 49 nationalities, so our language skills and our familiarity with the contextual backgrounds of the places that we work is pretty robust within our staffing. So as I mentioned, you can see here kind of the countries where we work, where we have staff. It's pretty expansive. Since 2020, we've procured over $2.3 billion worth of products. Again, that's about over 6,000 different products. We've shipped probably now over 15,000 individual shipments to 113 countries. And the vast majority of our shipments, based on the profile of the products, are really in need of special handling, cold chain, frozen, temperature controlled. So we specialize in that as well. So in terms of our procurement services, as was mentioned, we specialize in pooled procurement because we find that leverages opportunities for cost savings and efficiencies. And because we have a diverse set of clients, we are able to leverage the pooled procurement mechanisms to negotiate better prices and ensure reliable supply chains, streamline our logistics solutions as well. And again, our product portfolio is quite diverse, but we do have a special place in our heart for diagnostics and laboratory supplies, given the nature of our contracts and our in-house expertise. And if we don't have something in our catalog already, it's not a limiting factor. Our sourcing team is constantly working to onboard new products based on need and requests, and we're happy to do that. I think one of the things that we're very proud of and we've been forming over the last year or so, especially given the changing financing dynamics in the global health space, is access programs. We've worked with several suppliers to ensure that despite some of the traditional procurement mechanisms winding down, that if ministries of health or other eligible clients are still looking to procure with other funding sources, whether domestic or grant funding or what have you, they're still able to access the products at these preferential pricing rates through PFSCM. We are able to offer the lowest Ex Works pricing available. And, being a nonprofit, our procurement service agent fee is very minimal. It typically never really goes above 5% or so, but tends to be even lower often. So we do try to make this as affordable as possible for clients, and ensuring that these products that you've been working with over the past several years are still accessible through PFSCM and through the reputable manufacturers and suppliers that you're used to working with. And to do this, we have developed over the last year or so what we call the Health Supply Portal. And that is our kind of online portal, as the name implies, where clients can go in, they can see the products that we have offered, they can place their requisitions, and that way they can streamline the services, the purchasing and the orders of the products that they're looking for. And it's just one of the tools that we are using kind of in our suite of digital tools to support the end-to-end supply chain. But this is kind of really where it starts with our clients on contracts, that they are offered a curated catalog based on their needs, and it can be adjusted based on conversations with our team. So, what are the benefits of outsourcing procurement? I know probably most of your institutions have some type of procurement supply chain division who works really hard to make sure that you have what you need, but often probably facing some challenges. So we work hand in hand, usually with these procurement teams within other organizations, institutions, to help them, make their lives easier. Or if you don't have a procurement team and you're a lab manager and you're in charge of procurement, I'm sure, all feel that you have other things that you could be doing with your time rather than trying to place orders and negotiate with suppliers and fill in customs documents and all of that. So that being said, that's what PFSCM really does. So we're able to, one, leverage the power of numbers in by pooling the procurements that we do have, and based on the relationships that we have with suppliers, we can negotiate lower rates. We often are able to find other flexibilities in the contracting process, both with suppliers and vendors, but also our own. So we do offer various mechanisms to be contracting, whether it is a one-off procurement, if there is opportunity to, work with several organizations within your country or region, if there's ways to pool even through that and, find some type of other agreement that we can help organize those procurements, we're able to do that. We have other clients who have framework or IQC agreements with us where they place a yearly fund in our hands, and they draw down on that, so they don't have to worry about placing individual orders and the payment and all of that. So we are very flexible in terms of that. I think the other thing is that we are very diligent in terms of our quality assurance. We, make all suppliers and manufacturers go through their kind of QA processes. They're onboarded. There is a quality assurance guarantee from PFSCM that, we will comply bare minimum with the country requirements for quality. But more than often than not, it will be, WHO pre-qualified or stringent regulatory authority approved products that we will onboard to ensure that you are getting the best value for money. And that's something that we do work with both our clients to understand and select products that are best value for money, but all the way to the suppliers as well. So we have staff who have pharmacy backgrounds and technical backgrounds and quality assurance backgrounds to really help with that. And then our sourcing folks who are also experts in their kind of category of product to be able to provide the information that clients need. We won't tell you necessarily what to procure, but we can provide guidance in terms of what is the most fit for purpose products based on your needs. And then I think just to drill down a little bit into some of the product categories that we do have in our catalog at the moment. As I mentioned, we do, cover the range of health products. We organize our products by categories here. And again, we have experts in each of the categories to ensure that these products are, best quality and you're receiving best value for money, but constantly looking for alternatives, especially with the innovation going on in the market right now. I think specifically this group, I'm assuming, is focused on kind of the what we call the AMR catalog or microbiology catalog. And that, catalog of products ranges quite significantly from, basic lab consumables and reagents all the way through next-gen sequencing, which we have an extensive catalog and very good relationships with the suppliers of NGS products. So we are able to pretty much fully outfit a lab from, your Petri dishes all the way to autoclaves and bigger capital equipment. And this is just a little snapshot of the health supply portal. Honestly, it looks a little bit different now because it got a little bit of a refresh, but this is how you go in, you see the products, it gives all of the information on the products, pictures, specs, all of that, and you're just able to click and add it to a requisition should you choose to partner with PFSCM for your procurement and supply chain needs. Oops, this got a little wonky, but so again, QA, very important to us. We do quality control, quality assurance. We, have all of the certifications from 9001 2015 to MCOS to good EU GDP certification. And, I think that's something that we've heard regularly from labs in several countries is that when they procure locally, or from other sources, sometimes the products they receive really aren't usable because of the quality. And that is something that we do stand by, that we are very passionate about it, making sure that what you are procuring is of the quality and usable, so you're not wasting your time and your money, dealing with subpar products that can really affect your work in the labs. And then I think this just kind of shows also our end-to-end services. So as I mentioned, we'll source things, we will support our clients in product selection. We can even go in and help do some type of assessment of the laboratory to kind of better understand the needs and come up with a procurement plan. But then we also do everything all the way to delivery. So everything from the helping with the customs waivers and paperwork, consolidating, coordinating shipments, and then all the way to delivery. And that's something that we can either do at port in country, we can even do site level delivery if that is what you elect to do. And we provide visibility to our clients using our My Orders platform, so you can see the status of your delivery throughout the process, and we provide options based on obviously the needs of the product, whether they go air or ocean. Really depends on budget and product, I think, characterizations in terms of the need for safe transport. And then I think this is a transition slide. I'll quickly go over this and Tim will dive more into kind of our AMR strategic approach. So over the last couple of years, as we mentioned, Tim's very passionate about AMR. I've historically worked on Fleming Fund programs and have a place in my heart for AMR and the good work that you all have been doing over the past several years. So, we really do want to provide the support for clinical care and surveillance. We want to make sure that we're maintaining the progress that's been made through these investments, realizing that it's not necessarily one of the big three disease areas that gets all of the attention and funding historically. So to do this, we have been doing a lot of stakeholder engagement, as Tim had mentioned. We are part of the Fleming Initiative. We have regular conversations with stakeholders in the space, and to really understand the needs and the gaps that you all are facing in terms of supply chain and reliable procurement mechanisms. So because of this, over time, we've been expanding our portfolio of products with the lens of One Health. So at this point, we are able to also outfit veterinary labs and environmental labs should they be part of the program that needs procurement as well. And then again, creating tools that support these procurements, recognizing that oftentimes they are pretty low volume, they're niche, the products often have short shelf lives. So we want to make sure that our systems and tools are flexible enough so that we can provide our clients, the ongoing regular shipments, or are again able to pool with other labs, other entities within your country or region to ensure that you are getting the best price for your products. And with that, I believe I will hand over to Tim.
Thank you very much. Just to go over what you described, Amanda, generally we can source anything that's necessary, but typically these are the three main areas of what we consider AMR related diagnostics. That is microbiology, including everything for automated as well as manual culture and antibiotic susceptibility testing, molecular diagnostics, so PCR-based pathogen identification and detection of genes associated with antibiotic resistance, and then also sequencing, typically used more for surveillance, for more highly multiplex, deeper dives into the genes associated with antibiotic resistance. Next slide, please. And as Amanda mentioned, our interest and work in AMR has been increasing. We really got deeper into this around 2023, and at present, since 2024, we have delivered to AMR-related diagnostics within the microbiology specific category to 23 different countries. We have delivered over 172 different products, over 140 shipments, and a total of 3.4 million. And so you can see the global reach of the deliveries based on this map. These are the places just since 2024 where we have delivered AMR-related diagnostics for microbiology. And you can also see the increase in the amount of products that we've been delivering for between 2023, 24, and 25, where we've actually had an increase between 2024 and 25 of 650%. And we expect that to continue to go up. Next slide, please. We thought it would be useful to cite a specific example of one country where we worked in a narrowly defined project for looking at the AMR prevalence of bloodstream bacterial infections in Malawi. And this was for their nationally representative surveys that looked at health and economic burden. And these were for hospitalized patients. Our part of this was both in procurement and in logistics. So from the procurement side, we analyzed the product spend. We provided an overview of the manufacturers that were requested to be supplied and the products that were to be supplied. We managed the procurement costs. Logistically, we managed all the cold chain. There were a number of different cold chain products that were necessary. We managed all the tax and duty waivers, as well as managed the freight costs. Next slide, please. And some of the highlights of this project in Malawi were that there were first a wide range of manual and automated products that needed to be managed and delivered on different time frames. So we had incubators as well as analyzers. We had a number of different bacterial culture consumables. We had general lab consumables, sample collection kits, and also provided service, installation, maintenance training for the automated analyzers and incubators. There were fairly complex logistics. There were over 80 unique items. 90, most of them, almost all of them, required cold chain, so that had to be maintained throughout the whole process for shipping. And about a quarter of them had short shelf life that also had to be managed with multiple deliveries. The values that we provided for that were both in terms of cost savings and non-cost value. There were no temperature excursions during this shipment. And in fact, as an organization, we have not had any temperature excursions since about 2023 for any of the products we deliver for any of our clients. We dealt with expedited customs clearance to make sure that these products arrived in the labs in Malawi as quickly as possible. And we were able to procure the products for between 15 and 50% below the market cost that would have been had the labs order them on their own without using PFSCM. Those were the cost savings we were able to achieve for them. The total procurement was not huge, but it wasn't insignificant, so about $470,000 USD. And in terms of the cost that would have been paid had the labs done this independently, we achieved a cost avoidance of more than $1.4 million USD. Next slide, please. Oh, that's right. That's it. So thank you for allowing us to present to you. We would be happy to have a conversation and take any questions. If you have questions after this, please feel free to contact Amanda. Her information is there. Thank you very much.
Brilliant. Thank you so much, Tim, Amanda, for presenting this morning. I think that kind of showed the kind of really kind of strong opportunity for everyone on the call, and obviously everyone to kind of share the PFSCM webpage link as well to kind of partners and other colleagues to gain kind of more kind of information and how that kind of could look going into future procurement sales. I'll give it 10 seconds just to see if anyone in the chat wants to put a question in the Q&A function, or just the chat function if it works easier. And if not, I can always just start off while everyone's thinking of a question to ask. So I think I might just start with Tim, just kind of with that last slide that he just had shown. So obviously once kind of, James has just put his hand up, so I'll let James go first. If I unmute him. Yeah. Morning, James. Did you have a question for Amanda or Tim?
All right. Yeah. Good morning. Thank you for the wonderful presentation. Okay, I just want to ask, the first question I wanted to ask, I already saw it reflected in the map that you can send your product even to Africa, and when you're even talking about Malawi. So I'm actually from Nigeria. So, but the second one I want to know is that your products, are they for open system or maybe closed system, like we now maybe some of the equipment we are using for our AMR, our Vitec machines? And so does it fit in? And then also another question is, I also want to know, what is the minimum amount of product that one can order that you can be able to ship? Maybe you say a minimum of maybe $1,000, $5,000, so that let us know if we need to place an order, what is the minimum amount that you can be able to say you can be able to ship your products. So I would like to know that. And also the last one has to do with the issue of shelf life. That is one of the major problems we usually encounter. Sometimes before the product gets to us, there is already having, just a short shelf life. So is it possible maybe either the product can be staggered in the supply so that we're not going to have all the product being supplied and they're having a short shelf life, and before you know it gets expired? So I would like to know that. Thank you.
I can start answering some of those questions, and then Amanda, maybe you want to jump in with the harder ones. So yes, we absolutely can ship to Africa. In fact, over 90% of what we do ship does go to sub-Saharan Africa. We routinely supply consumables as well as Vitec instruments, consumables for Vitecs as well as instruments. We have a whole range of reagents, consumables for both manual as well as automated platforms for microbiology, culture, and identification. Trying to remember what were some of the other, actually, Amanda, if you remember some of the other questions you want to jump in. I know there was one about minimum order size. Oh, sorry, let me just, before I do. So in terms of the shelf life, we have in-house requirements that products have to arrive with a minimum % of shelf life available. And so we have all the orders, first making sure that it gets to the labs quickly by using expedited customs clearance is key, as well as then staggering the orders. So for example, in Malawi, because a lot of these things had short shelf life, such as blood culture bottles, we had multiple shipments to make sure that the products arrived with a significant amount of shelf life available. This does increase the cost. Obviously, it's more cost effective to ship larger amounts of products in bulk, but sometimes this isn't possible. And so multiple shipments of smaller quantities of products do need to be done.
Thanks, Tim. And to add to that, actually, specifically for Nigeria, Nigeria is one of the countries where we do have an in-country staff member who helps facilitate the customs and importation processing country, knowing that it can be complex. So that is, I think, one of the benefits that we do have a partner in country to work directly there to facilitate that. In terms of minimum orders, that's a really good question. So, I think typically our order size for individual clients, they find the most cost savings when it's above $100,000. $50,000 we do on occasion. Again, as Tim said, that could be like across staggered orders across, a year, a contract for a couple of years. Once we get kind of below the $100,000, $50,000 ratio, the shipping and PSA fees become a little less of I think value for money for us for the client. So we don't want to impose, if you can find quality products locally that don't require some of the international shipping and whatnot, then that often is a better route for clients. But if you foresee, long-term need, ongoing contracts that kind of add up over time, I think that's probably just a better, value for money for you. So, I mean, we don't necessarily have a hard and fast minimum, but we're happy to, have conversations with clients and run numbers to see if it works for you. I hope that sort of answers your question. We also do try to procure locally, if at all possible, or as local as possible. So regional and local suppliers, authorized distributors and whatnot. We do try to source as locally as possible, still ensuring quality.
Yeah.
Okay, thank you.
Yeah.
But
Thanks,
the last,
James.
you didn't answer one of the questions that I said, is it an open system? Does it fit in your product? Does it fit in for equipment? Or is it specific for particular equipment?
Yeah, so we can source all the different products for open as well as for closed systems. So you mentioned Vitek. We do supply Vitek products, but we also have things for open systems and manual.
Okay, thank you.
Mm-hmm.
Over.
Yeah, thanks, James. Some really good questions there. I have just put the link to the webpage that I think Amanda brought up on the slides, just so people can take a bit of a deeper look after this call. I did just have a quick question, I think a bit more towards Amanda now. When you were talking before about kind of the process, kind of contracting, procurement, delivery, everything that kind of comes about with the process. Is there a specific kind of point of contact the buyer gets when kind of dealing with this, or does it kind of depend? Again, you've just mentioned there's like local in-country contacts. How does that kind of work in terms of like the communication side from start to finish?
Sure, great question, Michael. So I think once we receive a request, we have what we call our client account managers. So they become kind of your one-on-one liaison for your procurement and the whole process. I support them up into the contracting process. So we make sure that we get your quotations and transport plans and all that squared away to give you an idea of what that would look like. And then with the contracting, our client account managers really kind of orchestrate the whole process behind the scenes, working with the respective units at PFSEM. And stay, I think they most of the time have at least weekly calls with clients or as needed, depending on the needs of the client, updates, fielding questions and whatnot. So we have those folks who are multilingual. We also have other staff members who are multilingual to help support that. And then we do have our kind of online tools. If you just kind of want to take a peek at where your order is, we have My Orders. If you want to place a new order, we have the Health Supply Portal. So you would have one point of contact who then facilitates everything else as well. But I mean, that's being said, if you'd help with the logistics, then someone from our logistics team would be made available to support as well.
Brilliant. Yeah, thanks, Amanda. Did anyone else have any questions? Again, if you want to raise your hand like James did, or in the Q&A chat function, I know Amanda's email did pop up on the last slide. So again, we can always just send that round at the end of this call if anyone has any questions that may not be currently stored in the brain at the moment. If not, I think I'd be happy to close. I might just give it another kind of 10-15 seconds in case there is any more questions. But if not, then yeah, I'd just like again to say thank you to Amanda and Tim for presenting and joining this morning. As always, the presentation will be going live onto the Fleming Initiative webpage and YouTube, which we'll share once it's ready. So I'm happy to close the seminar down now. Thanks everyone to join this morning. Hope to see you again very soon and have a nice day, everyone.
Thanks, Michael.
Thank you.
Thanks, everyone.
Take care.